Good morning. This morning we're going to talk about trach care. We're going to talk about trach change-outs and the gathering supplies necessary in order to achieve that goal. When we first get our patient and they are intubated, the majority of the times they will have some sort of tracheostomy that may or may not have a balloon. If it does have a balloon, you'll see the small little balloon attached to it, the little blue device right here, and usually it will be inflated. When it is inflated, the physician may turn around and add probably a cc and a half to 1 cc of sterile water into the system, and keep in mind that is sterile water. We will utilize the sterile water in order to inflate the ET tube around the tube, so that way we can minimize the amount of leak coming out from between the trach and the airway itself. So we want to turn around and when we prepare to remove it and change it out, we will take a syringe. We will pull back the syringe, pull out all the solution, take out any excess air, continue to evacuate until all the solution is out, and from there we will measure the amount of air that's actually in there. Once you figure out the amount of solution that's inside your trach, you have a secondary syringe that may have more than this that's actually in there. You may have 2.5 cc's of sterile water into it, and from there, when you want to reinflate, you will turn around and put the solution back in there, add the exact amount that the patient actually has. You will listen to breath sounds, listening for an air leak. Once your air leak is occluded, then you'll turn on, draw back to the small amount in order to create another air leak. When you instill the solution, it will occlude the entire airway. The leak is important so that way you don't cause necrosis along the tracheal wall. If you put too much solution, it's very dangerous to the patient, and over time it will cause a lot of damage. So we have to make sure we maintain a minimal leak technique. Once it's inflated, then it's good to go once it's inside the patient. And we'll cover that in more detail later on when we actually do a trach change-up. The second thing we're going to kind of go over is we're going to go over the supplies that are necessary in order to do a trach change. Some of the supplies that you're going to see is the stuff that's going to be cleaning around the tracheostomy. You're going to clean around the stoma. You're going to clean around the periphery, around the area around the stoma. So we have several things that are underneath the tracheostomy. The substance that we utilize here is called Mepilex. The small spongy stuff that we actually have to cut up ourselves in order to fit appropriate to our patient's population that we may have. If you do not have that, you may use a different product called Avant. Avant is very pre-cut. It has a small little hole in the center, and it's cut out to a specific size for your patient, and they may utilize this instead. Whichever your doctors may prefer is what you'll be utilizing in the facility. If you do run out of one, you can use the other temporarily until you get more supplies. The other thing that you're also going to acquire is some gauze sponges for cleaning around the periphery of the tracheostomy. We tend to not use the sterile, the regular 2x2. They come in a large package. Instead, we'll use the sterile gauze. This way we can maintain, it's not a sterile procedure, but it's a very clean procedure. By using sterile gauze, you can avoid any kind of infection that may occur around those areas. And the last two things that we utilize will be a sterile water, so that way you can kind of moisten the tissue so you can clean out appropriately, and then we'll use sterile Q-tips to clean directly around the stoma itself. And then we'll go over and talk about the technique itself in a little bit. And when you are doing any kind of tracheostomy care, we will always have a extra spare tracheostomy readily available, untouched, inside a package unless you actually need it. And then you will have some sort of jelly lubricant that you will apply to the tracheostomy, so that when you have to change it out and insert it, it provides a smooth insert into the tracheostomy. And then we will have trach ties. The patient will have a trach tie already on there, and from that trach tie we will create what we call a template. The template will be changed one time. We'll take the template itself. It comes in a very large piece. We will turn around and take the tracheostomy the template or the trach that's already there, trach tie, and we will match it up with the one that we actually have to change out with. We will line it up so that it becomes exactly the same size. We will take that trach tie, and then we will cut the part that we have. We will mark on this trach tie template. This template does not change. This template will remain all the time readily available, so that whenever you take the old one out, it's always matched up so that you can make a brand new template. This template will be your marker or your design for the other template that you cut out. So every 24 hours we change out these trach ties. We'll dispose of it, identify any kind of debris that may be on there in your documentation. We will match the other set up. Once we have it set, this goes back inside your template package. You'll insert into the package, tape this against the wall, and is not to be taken out or utilized by anybody else. Will be utilized just for the purpose of making a new template. And then the one that you have will be there. So that way you won't have to worry about taking it off, taking it on, and possibly losing the tracheostomy simply because you're trying to make a trach tie that's appropriate to your patient's size. That'll be all for right now, and we'll cover the rest in just a moment.